Hello and welcome to At the Heart of Health with Dr. James Markham. In today's well-marketed world, it's hard to know who or even what to believe when it comes to health care. In each program, Dr. Markham, a board-certified behavioral cardiologist, takes a balanced approach using common sense modern medicine and the ultimate source of truth, the Bible, recognizing that at the heart of health is love.
I'm Dr. James Markham, and welcome to Heart of Health. Today we're specifically going to be talking to the men and maybe the wives out there that are watching. Why can't I get my man to go to the doctor, you might ask, or what are some of the issues that men are very concerned at? We're going to be talking about all of those on Heart of Health. And in case you want to get hold of us at Heart of Health, go to our website, heartwiseministries.org. We'd be happy to answer your question. Today we have a special guest and a friend I've had for years, a person that I've worked with. His name's Dr. Dennis Thompson. Dennis, welcome to Heart of Health.
Thank you for having me.
Now, one of the things we like to do is move people towards healing. And what got you involved? I know you've done many things in your life. What got you involved in healing through medicine?
Well, originally I graduated from college. I was planning on teaching at the college level, but then I was not satisfied. I was actually a chiropractor before I went back to medical school. But my license didn't allow me to do the things that I wanted to do. And so I went back to medical school a little bit later, and now I'm a board-certified family medicine practicing, as you know, in Cleveland.
Wow, and I bet you see men a lot in your practice.
Yes, I do.
Now, what's the #1 barrier that you think keeps men from going to the doctors?
Some of it, I think, is their machismo attitude. Men feel like they're invincible through much of their life, and they don't realize that there may be disease processes that are going on, even though they feel okay.
You know, one of the reasons I like to have people come to my office is an opportunity not only to meet their physical needs, but you get a chance to meet their spiritual needs. As we were talking off break, you know, it's very important to address the ultimate healing, which comes from a relationship with God.
The only healing that ever occurs is through God. We can put a Band-Aid on, we can put sutures in, we can open up an artery, but the only healing comes through God.
Well, Dennis, I'm going to ask you a personal question here on air. Tell me, have you had a general physical this year?
I did last year.
You did last year. So you're one of those machismo guys, right?
I guess so.
Okay, so if you're, now what would you tell wives and concerned others? How would they get a man that's reluctant to see a doctor? How would they get him in for some of this healing we've been talking about?
Well, actually, men don't have a primary care physician. They have 30% less than what women will go to the physician, and over 40% don't have any preventive care. As you know, arterial disease, coronary artery disease is a leading killer in men, and there are several risk factors that can be modified to reduce the risks of heart disease. And I guess imploring the man to go and try and address some of those issues is about all we can do. Maybe if the wife tells him how much she loves him, that would be of some assistance.
Oh, I think that would be great. You remember, at the heart of health is love.
Yes.
We're going to be talking about this topic and many more, and hopefully as we go today on Heart of Health, we can get everyone to understand how important it is, especially the men, to see your doctors and move towards healing. When we get back, we're going to go to the questions. I'm Dr. James Markham, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
You can easily spend $90 on an expensive meal out. How about investing $89.94 in your future? Just think about the possibility of coming off those prescription pills and getting rid of all the side effects. Think about feeling better than you have ever felt in your life. This is all possible for you. For only $89.94, you will receive a 7-part DVD series, Weight Management by the Book, a 30-lesson workbook with over 100 recipes, and if ordered today, exercise tubes will be included for free to help with your journey. There are many programs available, but this unique program has identified the truth about how to manage weight. This program is not available in stores. This limited offer will not last long. Pick up the phone now and dial 877-504-9628. Operators are standing by. This call will change your life forever.
Two words for you. Pop quiz. Ready? Name any funny movie. A drama. Name a mystery. And one more thing. Name the movie your kids saw today in science class.
Know what really matters. Know about your kid's school. And know about your kid. Find out 100 ways to know more, do more.
Welcome back to At the Heart of Health. I'm Dr. James Markham, and if you're tempted to go over there and watch the football game or watch the Munster cars or do something else, I want the men in our audience to pay attention for a few minutes. We got some great tips from Dr. Dennis Thompson. At this point, Dr. Thompson, we're going to answer questions that's come in from HeartWise Ministries from all over the world, specifically dealing with the health of men. The first question is great, and they label this a skeptic in California. This skeptic writes, I never have seen a doctor. I feel well. Why should I go? If I go, what should I expect? And how do I know if the doctor is doing a job? Let's start with why should anyone go to the doctor?
Many times, unfortunately, disease processes don't have symptoms. High blood pressure, for instance, is called a silent killer. Most of the time, you don't have any idea, and that's why it's good that they have screening processes available in the mall and things, but also sometimes the accuracy may be in doubt. So that would be one reason. 20% higher incidence of diabetes in men than than in women. Another reason that you should have that checked. Every man should have his cholesterol checked at least every 2 years. Skin cancer is one of the leading cancers in men as well. And so to do a good screening, especially in California where there's lots of sun, would be very helpful as well. So the short answer is many of the disease processes don't have any symptoms whatsoever unless they're detected.
Okay, so going to the doctor, this skeptic might find out something hidden underneath the surface that can be discovered.
That is correct.
Okay.
And many times when they would go in, you should expect that you have a complete physical to go over the history to try and risk stratify, find things for that individual that would help them with their health throughout their life, to try and avoid disease. And there's a big push to wellness these days, and that is to keep healthy, not just to avoid disease, but to enjoy life.
Right, right. Now, so the one reason to go is if you just to screen for these hidden diseases. But if a person's having a symptom,
then they should go much sooner, absolutely.
Now, how would you define the word symptom?
It could be anything from just fatigue to chest pain to just not feeling well. I commonly see people and their main complaint is, I'm tired. I just don't feel good. And that would be a reason to go in.
You know, Dr. Thompson, my back is hurting right now because I have to sort of sit up straight here. Would that be classified as a symptom, or is that just an ache and pain?
That is a symptom. It may be simple musculoskeletal and many times will go away.
Okay.
But as some people have said, the 5 most dangerous words, maybe it will go away, can sometimes cause trouble.
Right, especially in the heart business. You know, maybe this chest pain will go away.
To just hide our heads in the sand and pretend we don't have anything is probably not useful.
So anything that doesn't feel normal could be classified as a symptom.
Absolutely.
And that could symbolize that something else is wrong.
Yes.
So if you're having symptoms or to screen for disease, that's one reason the skeptic can go to the doctor.
Absolutely.
Now let's go to part 2. If he goes, let's say he goes to your office. He comes in to see Dr. Dennis Thompson because he feels well. What should he expect when he goes there? We don't want to overwhelm anyone with their first visit to the doctor. What should he expect?
Usually that's going to entail a comprehensive physical, to discuss his life style, things that maybe could be improved, but additionally, likely it will include some blood work, looking at the cholesterol, screening for diabetes, check his kidney function, the liver function, and that's a fairly standard screening panel.
So you have to check. Now I have a question. Can you do blood work without the needle?
No.
So you have to get the needle. I don't like that.
But they're tiny.
Okay, so you can expect some blood work. Well, could you expect any conversation, people touching you, all those things?
To do a very good physical exam requires hands-on. They're going to be listening to your heart, looking in your eyes and ears and throat. Actually, a good preventive healthcare physical would include a skin screening as well.
Now, do you guys still do the prostate exam and where you feel the prostate and all that?
Only if it's indicated, and that's a very controversial area. If you're between, say, 35 and 45, probably would not expect that unless there's a very strong family history.
Okay. Now, what about this one? Have you ever seen him turn your head and cough? Do you guys still do that for hernias?
Do we do for hernias? Yes. It's actually part of the standard physical for high school athletes.
Okay. Cardiologists don't do that much. We don't usually do that. We just get the stethoscope. We feel, but some of that, I don't know if I'd like to do that.
If you've been in the military, you've had it done.
Okay. Well, let me go to the third part real quickly. How do you know if the doctor is doing a good job?
If he pays attention to you. If you don't feel comfortable with the physician that you go to, everybody should feel very comfortable who they go to. It is a relationship, a trust relationship that needs to be developed.
Choosing a physician is one of the most important things a person will ever do in their life. You spend more time choosing your bank or your church or your dry cleaner than you do thinking about and looking at the correct physician. So I think that's very important.
And it's nice when you can have a referral from somebody that's been to the physician. It really is helpful to know who the physician is and how they work. Different personalities many times like to have different people.
Well, I hope that answers our skeptic's problem and question as well. In the next section, we're going to talk about impotence. So don't go away. Keep your eyes tuned to At the Heart of Health. We'll be right back after this short break.